Minister Sri Damodar Rajanarasimha Garu, the sector is seeing a remarkable growth. Hyderabad has already much of what's needed to become a health capital of India. Strong biomedical and technology capabilities, research institutions, academic centers, a growing digital ecosystem, and a progressive policy environment. Brought together with clear coordinated vision, I believe Hyderabad can become not just a major healthcare destination, but the health capital of India. But an ecosystem's real strength lies not just in the excellence of individual institutions, it lies how effectively they work together. Governments, hospitals, doctors, researchers, technology, companies, industry, and the civil society each have its distinctive responsibilities. The future of healthcare depends on bringing these capabilities together in a balanced, coordinated way. And that is where platform like FICCI matters. FICCI represents industry, but our purpose shouldn't stop at articulating what industry expects from the government. The more important question is what society...
And honor for me to be here as a co-chair of FICCI Telangana Health Panel. Thank you, Chair, Deepthi, for your amazing address, and you've actually put it forward what exactly FICCI Health Panel is going to do in the next year or so. At this point of time, I just want to pause for a few seconds and ask you a deep reflective question. What comes to your mind when you talk about future of healthcare? Right? You talk about AI, robotics, precision medicine, digital health, genomics, newer technologies, right? But I want to start with a very basic and a simple reflection. Why don't we go back a step and look at, what is it that it is going to deliver as far as the outcomes are concerned to the patient? What does the patient want is a simple question, right? As a patient, what is that, the delivery of whatever kind of healthcare that you want to give is asked of or requested. So the requirement of a patient, if you see, I strongly feel, we are looking at a better health, we are looking at better health facilities, better outcomes, better diagnosis, or for that matter, better access for healthcare for every citizen in this country. So if that's what is the requirement, I would say that we need to actually move to an important aspect of, from healthcare, what we call today is not really healthcare, it is sick care. I always say this, right? So the present healthcare is actually sick care. People who are sick will come to hospital. Now from that, we need to move to something which is so close to my heart, preventive healthcare. Right? Can we, prevent a patient coming to a hospital? Can we identify a person's, risk factors before he becomes a patient? I think that's what is the future is going to be. Thereby, you can actually prevent many non-communicable diseases, including cancer. So, I think as a cancer surgeon, every day when I operate or when I send a patient for chemotherapy or radiotherapy, I always think of one question: how I wish this patient would have come much earlier. What if we could have prevented this disease? When I started Grace Cancer Foundation about 14 years ago, the impetus for starting that movement was very simple and a profound truth. 28 years old, tobacco addict for almost 15 years, right from childhood he was a tobacco addict. He came to stage 3, oral cancer. We did a major commando operation, reconstruction. Within 6 months the disease recurred and we lost him. The family didn't have money to take the dead body back home. That was the trigger for us that we had many opportunities to intervene, not just diagnose early, but even to prevent at multiple occasions, change in his lifestyle, behavioral modification. Somebody could have, advised him. So that is the kind of a stimulus that I had personally to start this movement of preventive healthcare, especially with respect to preventing cancer. So as FICCI Healthcare Panel today, I would say that when we think of the future of healthcare, the future lies in prevention. So if we can actually prevent many of these diseases, the population health is what if we can focus on, probably that is going to be the big changer. So now the second question that comes to my mind even as we talk about the theme for today is, we are all talking about AI, and I'm so fascinated with AI because many of you know that, I was a small catalyst to, make AI in healthcare, a reality, and thanks to the conversations, and as Professor Arun Tiwari always says, pollination, when good people come together for some greater good happening, right? And that's when, Mona ji was with us for the conference, and we were able to connect the dots and, kind of give that push, the necessary push, the right push to make a responsible AI possible and help the system build so that you can make better policies even as we, endeavor through FICCI healthcare panel. So now again in AI, I always say, many people come to me. Even yesterday I was talking to a group of young, startup guys who were asking me, they came up with a solution and they were asking me, is your problem right? They were trying to figure out, they started from reverse. They had a solution, they wanted to identify the problem. I think we need to really look at technology is just a tool. You need to look at the real world problem and solve it. Then only it's going to help our patients. So I think, the clinical impact, today, if I say clinical impact, you may be wondering, many of the corporate hospitals, including the one where I practice, how do we measure clinical impact?